This is a long video setup sa back using yung malalampanan.
After preparing the patient, writing the data and the board, the staff nurse responsibility is to prepare the back table and the standard instruments which will be used during the operation. Of course, inside our theater, since this is a restricted zone, it is a must that you should wear your scrap suit, your OR slippers, your cup, and your surgical mask. So you do not enter the operating room theater without this coverings or PPE. But for demonstration purposes, I will not create mask. Okay? So in preparing back table, of course this is our back table in the operating room, and this is our Mayo tray. Okay? So this is where our instruments will be placed later. So in preparing your back table, you can use your pickup forceps to open the OR pack. But for the meantime, you can also use our bare hands, since this is the unsterile part of the OR pack. So pwede pa okay. So we can already use our sterile pickup forceps to open our sterile pack. So in our sterile pack, it includes our OR gown, 2 OR gowns, your Mayo drape and Mayo cover, towel drapes, and your foot drape, and lastly the lap sheet. It's already mentioned in our OR set. Okay? So after opening your OR pack with the gowns and drapes in it, we will already place sterile instruments in our back table. So we will start with our basic. In offering sterile pack, we start first with opening the third pack away from you. In order to maintain sterility, we can secure the cover and then place it in our back table. Okay? And all covers of your sterile pack will be placed neatly in a hamper. Next is our sponges. Secure. Make sure do not touch the sterile area or the sponges. Next is our retractors. So depending on the type of operation, but for cesarean section, the doctor usually use Richardson's. Instruments.
So take note, inuna pa rin ni Sir open ang sponges.
We'll also be placing our gloves. So we will be preparing 2 sets of gloves. scrub nurse. But in the hospital, since you as student will be functioning as an instrument nurse, then we will be placing 3 sterile gloves in the back table. So before you're going to place the gloves in the back table, make sure you ask first the scrub nurse on duty of the size of the doctor and of course the size of the first assist, which is the scrub nurse. And of course your own gloves in the back table. So make sure still maintain sterility when placing sterile objects, especially in the sterile field. Our fourth one. If our sterile item is in a packaging unit, take note of a tear indicator. This is where you're going to tear your sterile package. So meron tayong mga indicator like for example sa syringe or other sterile pack. So you just tear it off. Make sure it does not touch the sterile item. And then our surgical blade. When you choose your surgical blade, you also have to be considerate of the type of operation that is going to be performed to our patient. So it is according to the number of the blade. Okay? So the smaller the number, of course, the larger the blade. Or the smaller the number, the smaller the blade. Like that. Okay? And with the number, this has a corresponding number as well in the blade holder. So next we are going to prepare the sharps. So in preparing the sharps, as what I told you earlier, the sharps is soaked in a soaking container. Make sure you check the soaking solution of the expiration so that it will ensure that your items are still sterile. So you'll start with your Mayo scissors. So your sharps include your Mayo scissors, Matsambong, needle holder, palm forceps, tissue forceps, another blade holder, 2 blade holders, needle holder for alternate. This is our blade holder, which in combination with your blade makes up your scalpel or knife. Your suction tubing, suction tip, and your alternate. You do not include the tip of the wire since this is not stereo and it is not soaked in a solution. So these are the instruments prepared in the back table. And of course, you have to anticipate as well what type of suture the doctor prefer or the Okay? So because some doctors would prefer chronic, the others may prefer other type of suture. So you ask first the scalp nurse or the surgeon on their preferred suture. So that before you place it in the back table, the proper suture is already being open. Kasi pwede masayang. Okay? So that is on preparing our back table. Next is we are going to have our gowning. Okay? So before you do your gowning and close gloving, make sure you already did your surgical hand scrubbing. Okay? So in doing your gloving and gowning, so naka-surgical scrubbing ka na sa labas, no? In the OR sink. Okay, so there is an appropriate way of surgical scrubbing which will be recorded separately in this video. Okay, so assuming that I already have I already finished my surgical scrubbing, and make sure you wear your mask, your cap already, kasi para tuloy-tuloy na ang inyong perform na procedure. Okay, so for demo purposes, I will not wear mask. Okay, so you are already sterile and your hands are already clean because you did your surgical scrubbing. So what we're going to do is, next is to pick up one gown, then drop it. You can use the bottom of the gown to wipe off your hands. Be sure you stoop a little so that the gown will not be touching anything in the surrounding. Okay? And be careful not to go very close to your back table because you might be contaminating the table. Remember, you are not sterile and our back table is already sterile. So after drying your hands, you can get the top part of the gown. And what are you going to do next? You have to locate the sleeve. Ayan. So the sleeve is already sewn in such a way na folded na yung part ng sleeve para ipasok mo yung kamay mo. Both hands. Ipasok mo muna. Again, ipasok. And you ensure na yung opening nasa labas ninyo. The opening. Okay? That opening. Hindi dapat yan nakaharap sa inyo but away from you. So make sure you already secured your hands first before opening your arms. Okay? So when you already inserted your lower arm to the sleeve of the gown, you are now ready to open the gown. Okay? In opening, you ask the circulating nurse to tie the back of the gown. Okay? So make sure, huwag kalimutan, do not let your hand go out from the sleeve. So dapat nakasecure pa rin siya. Remember, your hands are still unsterile and you need to wear first sterile gloves. So you secure your hands first within the sleeve of the OR gown. Okay? So this is the gown. Hanapin nyo muna yung sleeve before you open the gown. So next, you will do the close gloving. In doing the close gloving, make sure your hands are still secured inside the sleeve of the gown. So you get the gloves appropriate to your size 7, and you can place it anywhere. You can touch actually anything in the back table since your gown is already sterile. And remember, pag naka-gown ka, dito lang at the level because below the waist level and your back is considered sterile. Okay? So in gloving, this is your gloves. Ibalik natin, we open it. And remember, label ng gloves, merong right, R for right, left for left hand. So what are we going to do in a close one to this one. Okay? And then you open. Since you already inverted the surgical gloves, mean to say that your right hand crosses over in this side and your left hand crosses over in this particular side. So what you're going to do, right to right, grasp with your hands inside the sleeve of the gown, grasp the right gown, grasp, and then place it in your hand, okay, like this. And insert the folded portion of the glove. Secure the gloves in the sleeve of your gown before you bring out your fingers and hands. Okay, ayan. So, adjust mo konti and then secure mo na yung gloves. Okay? So, this is already sterile, so you can already touch anything in this particular. Next is left to left. The same, grasp part of the gloves and then insert it in your. When you insert it, you can already bring out your fingers and your hand. You can adjust and then secure it with. Usually, if the patient is HIV reactive or HIV positive, doctors and nurses would do double gloving. Okay? And yung mga wrapper, you just turn and then lock. Make sure your hands and your arms are maintained at this level. O yung mga organ na may mga pockets dito, you can put your arms inside the pocket. Okay? So that is for clothes, that is for gowning and clothes gloving. Now we will do the preparation of the Mayo tray. Okay? So for the preparation of the Mayo tray, set aside first the doctor's gown. Tatlo ang gown actually sa estudyante, sa staff nurse, and sa doctor. So pero sa ngayon, we will demonstrate the part of the doctor. Okay? So this is the Mayo cover. Pansinin ninyo, para siyang punda ng unan. Okay? Para siyang punda ng unan. So how are you going to prepare your Mayo cover? First, you spread it. And then you fold it like this. Okay, spread. And then fold. Yung dulo ng Mayo cover, you curl it with your four fingers inside. And yung i-fold nyo nakaipit doon sa loob. Ayan, nakaipit. No? Ang four fingers nyo nakatago. Bakit nakatago siya? That is to ensure na hindi makukontaminate ang kamay mo when you insert the Mayo cover. Thumbs out. Okay? So this is your Mayo cover. Make sure some of the Mayo stand is movable, no? Hindi nakalak ang wheels. So, when you insert your Mayo cover, make sure that you step on the stand, okay? And then, insert in your okay. So, yung mga naka-fold dyan, you can hold this part, then bring this down, adjust, okay? So that you still maintain sterility. So that is how you put your Mayo cover. Next is your Mayo drape. Get one drape and cover it in your Mayo drape. Okay? So, what else we're going to prepare? We are going to prepare first the drapes of our patient. So this include towel drapes, 4 towel drapes. This is folded like this. When you open this tray, you fold 1/3 of the drape. Apat yun siya.
Okay. Yung ginagawa ni Sir Andrew, that's only for...
So 1, 2, 3, 4.
Demo muna.
This is towel
Demo lang
drapes.
pa
Which can be used.
diba sabi demo. Pero never ever do that in the area. Yung ihang ninyo yung towel drape. Kita niyo yung ginagawa niya kanina. Ginaganyan niya. No, that is only for demo purposes. Doon sa area, pag nilapag ganyan yung towel drape, huwag ninyo siyang i-open na ganyan in air. Bakit? It can harbor microorganism. So, pag nakaganyan na yan siya sa table, you just open it horizontally, hold it 1/3, then that's done. Okay? Hindi na kailangan i-alsa-alsa pa. No? For demo lang yun. Makagayahin ninyo. Okay? Sige.
Prior to the foot drape and the lap sheet. Then after you fold it, i-fold back nyo ng asa fold. Okay? And now we will be preparing your sponges. Make sure you count the sponges individually. No? I-check nyo kung wala mga nagdikit-dikit pa na to ensure the counting is correct. Okay? 1. So we have 5 sponges. So normally, in a set, sa back table, we use 5 sponges. Okay, so what's the purpose of these sponges? This is of course to, if there are bloody secretions, then this will be used as a sponge. Next is we're going to prepare our instruments in the OR Mayo tray.
Action.
Okay, before we put our instruments in our Mayo tray, we can use a roll in order to arrange our forceps well in the Mayo tray. So in making our gloss roll or spring roll, lumpia, so if the cloth is very
This spring roll
thick,
half.
then you can fold it in half.
Trochanter
Then,
roll.
make a triangle, fold it in the side, and then you can roll the... Make sure when you roll it, it is firm, para hindi siya luyat mamaya. Then you can place it here. Okay? So after that, you can already get your instruments. Be careful not to drop any instruments in the floor. So we can get our instruments and as well as our sharps. Since our towel clips is not used as part of our instruments in the breaking room, this is a towel clip. We will place it in the back table. This will be used in the towel drapes. So pwede ilagay mo na sa back table. We'll use it later. And place your then place your awful forceps at the back table as well. And also get our blade and our cork in preparation for operation. And you can arrange already your instruments in your bag in the Mayo table. Of course, the arrangement of instruments will depend on your convenience. Saan mo madali makuha? So, i-separate mo ang forceps mo, clamping forceps sa iyong sharps. And then yung inyong retractors. Okay? So, we will be setting up the scalpel or knife. So, what are you going to need in setting up the scalpel or knife? Of course, this is your blade holder and then your blade. Okay? Blade holder and then blade. So in setting up your knife, you get the needle holder and then grasp it at the tip of the blade. And as you can see, there is a angle here, a slant. The slant here of the blade should coincide with the slant of the blade. Grasp. So, tingnan ang slant. Slant siya pag ganon. Slant din dyan. And saan ka mag-start? Sa center ng blade. You start at the center. Ito.
So, yung paano niya i-clip yung
Center
blade
of
ha?
the blade. And then, secure. Okay? So, that is how you make your or prepare your knife. Okay? So, make sure that your knife is safe because this is sharp and this could cause injury. Place it under your rolled cloth to secure it and prevent from injury. Okay? You already have report now. Next is we're going to set up the suction tube. Okay? If the suction tube is in a packed, pre-packed disposable type, then you can already put the suction tip to the suction tube. This is the suction tip to the suction tube. Of course, in the hospital, what we use is a disposable one. So, this is an example. This is a abdominal suction tip. Meaning to say, there is still a suction guard. No? So kapag magsa-suction sila in the abdominal area, in the deeper tissues of the abdominal area, suction guard is in place. Pero kung hindi naman, we can remove the suction guard. We can use this suction in the particular part of the body. So this is the suction guard, and this is the actual suction. Okay? So ang purpose ng suction guard is not to irritate the visceral organs in the abdomen. But of course, meron tayong disposable plastic na ginagamit natin sa and of course, our suction, our battery. So we have to prepare. Naka-arrange na yan after we prepare ang gown ng doktor, ang towel drapes, foot drape, and the lap sheet. Okay, so only sterile, one of the principles, as what I mentioned, the principle of sterility. Sterile object only should be touched by sterile items or objects. So since I'm already sterile, I'm allowed already to touch anything in the sterile field. Okay, so when you go and prepare your lab table, make sure huwag ka masyadong dikit. You keep your distance. Pwede mo ilagay ang kamay mo dyan because it's stereo, or dito sa inside the OR. Meron tayong packet dito in some hospitals. Okay? And make sure, hindi ka basta-basta, since this is unsterile, wala pa ito na-prepare, you also keep your distance. Okay? Okay? So keep your distance from time to time. Kapag sterile lang naharap mo, you face the sterile item. So huwag kang magtalikod. Kasi baka maatrasan mo, ma-sterile yung table. Okay? So yeah, pwede ka mag-atras dyan. Anyway, sterile ang likod mo. Sterile to sterile. Okay? So what if may may nurse ka na magdaan dyan? So what would be your position? For example, dadaan ang circulating nurse sa'yo. So ayan, dadaan siya. So make sure na harap siya, tatalikod ka. Okay? That is to ensure na hindi ma-unsterile ang inyong gown and okay, so that is in the OR. For circulating nurse, yung hindi naka-sterile gown and sterile gloves, make sure huwag magdikit-dikit dito sa ating sterile area. Okay? Kapag mag-audience kayo, medyo malayo sa back table. Okay? So that is our preparation of our back table.
This one, for example, this is the OR table. Up until this one is covered by the linens, this is considered unsterile. Even the patient himself or herself. Okay, so kung ikaw nga naka-gown ka na dira, naka-gloves ka na, wala ka nang ibang gagawin, no? Plastada ka lang doon sa iyong back table. Okay? Wala namang sa iyo, wala nang iuutos sa iyo. Ang uutosan dyan yung circulating nurse. Okay? So, the lights, no? Care of the circuit. Kung meron yung handle dito, care of the circuit. Okay? Circuit lahat yan ang mamanipulate. Okay? Kung may handle na dito, huwag nyo na si circuit, back off na din. Kasi kung may handle na ito, that is considered sterile. Yung mga sterile members of the surgical team na lang din ang pwedeng humawak dito na part. Kasi ito, this can be sterilized. No? Then, yung sinabi doon kanina na the sharps are found in your soaking solution. Okay? So, doon sa loob ng operating room, we have different solutions. No? Doon sa gilid-gilid dyan, may mga estante, may mga drawers dyan. So, sa ibabaw ng drawer na yan, you can find this type of trays. No? May mga malalaki pa. Ang laman niyan is instruments. No? So, dito, first tray, let's say for example, this is your soaking tray. Soaking, ibig sabihin, disinfection solution. No? Doon siya disinfect. Soaking. No? Gaano katagal, sir? Most likely, kapag emergency, no, nahulog. Yun lang ang mag-isa na instrument. Ito, nahulog ito. Wala nang ibang ganito sa ospital. No? Nag-iisa siya. Nahulog pa talaga. Hinugasan ni Sergio. Ngayon, ibinalik ni Sergio dito sa soaking solution. Gaano katagal bago gamitin ulit? 30 minutes. Okay? So, maghintay sila dyan. Hanggat ma-sterilize itong instrument. Hindi mo man pwede i-autoclave. No? Kaya kung i-autoclave yun, saan lang matagal? Oras-oras pa yung autoclave. Okay? So, soaking solution lang. Then, after soaking, you have your, pabadlawan mo man siya, you have your rinsing solution. Okay? Pag nanggaling dito sa may soaking, hindi mo siya pwede kidiretso doon. Okay? Kailangan mo muna siyang banlawan in English, rinse. No? So, what you call that one? Your rinsing solution. Other separate, ano din yan siya? Separate tray. Okay? Ano pang pulot? Kamay. Char. Ano pang pulot? You have your pick up forceps. No? So, paano nga hawakan ng pick up forceps? Yung dulo must be always down. Hindi pwedeng itaas. Kasi kapag tinaas mo yan, tapos binaba mo ulit, that will be considered unsterile. Okay? So, this is your pick up forceps. Always hold it in this manner. Nasa baba itong tip. Never up. Okay? Down. So, pag kumuha kayo, soaking, hugasan sa rinsing, before A, kung saan prefer ni nurse or ni doctor ilagay. Trabaho yan ni circulating nurse. Okay? Next! Ano pa yung mga nandoon sa video na nadagdag nga? Okay na tong, Ma'am Je? Katong kutob lang dito sa back table. Okay na yan? Sige. So, question. Regarding the video, inulit lang. No? Mas thorough lang yun doon kasi nga continuous ang pag-perform ni Sir Andrew. Okay? So, ganun lang, no? If you are hesitant in what you are doing, ibig sabihin, hindi nyo na memorize lahat. Okay? Ang pagkakasunod-sunod lang naman ang importante dito sa preparation, no? Yung pagbukas niya ng instrument, ginaya niya din doon sa may pagkakasunod-sunod na sa whiteboard, SI. No, nasa dulo na yung needles. Kasi nga, anong sabi ni Sir? Saka ka mag-open ng needles pag sure ka na kung ano ang gagamitin nito. Doc, ano po ang gamitin natin na suture, Doc? Okay? So, syempre, pag sinabi, paano tayo, ma'am? By krill. No? Okay, Sir Q, by krill. Ano size, Doc? 1. Is dalawang 1, isang 2. Okay, isang 1, isang 2. Okay, ganon. No, bicryl, monocryl, those are the generic, no, generic na mga names, chromic, ganon, proline. Those are the generic. Yung mga sinabi namin kahapon, monolus, okay, solus, yun sila, bicryl, yun sila as a whole. Monosin, monolus, that is monocryl. Okay? Kryl ang CRYL. Those are the generic names. Yung brand names is yung monolus and yung solus. No, pero katingala mo dito, pare-parehas lang sila. Okay, so you just read the packaging and the number or the size para hindi kayo ma-confuse. 1, 2, 3, 4, 5 lang yan, hanggang 5. And of course, you take note kung mayroong needle or walang needle. Nandoon yan lahat sa packaging. Okay, merong walang needle, merong dalawang needle, no? Both ends are needles, merong isang needle lang. Okay? So, yun ang mga iti-take note ninyo doon sa packaging na sutures. Okay? So, if those who are still waiting for their turns, you practice, no? We may ask some questions, pero pag gamit ninyo, i-memorize niyo muna paano niyo siya in-unfold para marunong kayo paano siya i-fold ulit. Asa na itong tela gahapon? Ay. Oh, yan. Yung jacket ninyo. Okay, so dito, practice ninyo ito pag-insert ng punda.
Gusto ko next week pa naman. Next week pa naman. Doon ka na sa OR pa? Sa 2 OR stimulation?
Sino ang group ko? Kindly raise your hands. Dito front. Up to means apelyado. Abdul Karim. Ilan kayo? 10?
11.
11?
11, sir.
Okay.